Hello and welcome to There is a Beautiful Me. This show is focused on empowering women in all aspects, physically, spiritually, and emotionally. Overall, this is geared towards helping, guiding, and motivating women to want to do more for themselves and always to keep God in the mix within it all. Throughout the show, we will go deeply into a Proverbs 31 foundation and cover a few verses over the chapter and break them down on a spiritual perspective that we can apply to our daily lives. Today's show, we will be breaking down Proverbs 31, verses 14 and 15. Verse 14 reads, "She is like the merchant ships bringing her food from afar." Verse 15, "She gets up while it's still dark. She provides food for her family and portions for her servant girls." Both of these verses remind me a lot of my mother and also how women in general provide for their families. For instance, majority of the time you see the average mom out in the grocery store gathering groceries for her family to bring home and cook. It seems to be without second thought that we automatically do this. It's in our nature to be that provider and that caregiver for our family. And even if it's not making the food, we will go out and order food. But the main point is we bring the food home to our families. Now, the next verse really shocks me because I see this example every single morning. I'll be asleep, but then I'll wake up to find my mother downstairs cleaning and making breakfast, and it may be 5 a.m. I would always be confused when I was younger because I didn't understand why she did that. When I read this verse, my question was immediately answered. The verse says, "While it is still dark, she wakes up to provide for her family." I don't know about you, but that can be difficult to drag yourself to do. Naturally, as she did this over the years, I got accustomed to it and would find myself even in college just waking up early, if not 5 and 6, just to get ready about my day. I prayed about this and asked God to prepare me for this point in time so I can be that woman He has called for us to be. Now it is no dragging. I wake up at 5:30 every day and weekends, but it was the example around me that encouraged me to do that. And that's what God does with the people in your life and around you, whether it is a mom or a role model you look up to. Starting off early when it still is dark can prepare you for your moment when it is time for you to provide for your own family, if not already. Next, I have Dr. Alicia Hopkins. She received her medical degree from Ohio University College of Osteopathic Medicine in Athens, Ohio, completed residency training in Louisiana State University in Shreveport, Louisiana, and is a board-certified family medicine doctor. Currently, she is practicing in family medicine at a local community clinic. She has interest in preventative medicine and women's health issues. And she is here in the studio with us today to talk about diabetes and the causes, types, symptoms, and prevention. So, Alicia, thank you so much for joining us and welcome to the show.
Thank you for having me.
Thank you. So, can you tell us just about diabetes in general? What is diabetes?
Sure. Diabetes is when the body produces too much glucose, too much sugar. And there are several different forms of diabetes. Of note, there are 3 different forms. The first type is type 1, and it usually presents in individuals less than 20 years of age, but can occur at any age at all. The pancreas does not produce enough insulin. That's what happens in type 1 diabetes. Type 2 diabetes usually occurs in persons over the age of 30 years of age and is the most frequently type of diabetes diagnosed nowadays. It's when the pancreas produces insulin, but sometimes not enough, or the body doesn't recognize the insulin that the pancreas is producing. The third type of diabetes is called gestational diabetes. It usually occurs in pregnant women only. The pancreas is unable to produce sufficient amount of insulin. This can be controlled by diet, exercise, and also by the use of insulin medications.
Okay, so just to backtrack to type 1, because you said around age of 20,
Sure.
That's when that shows up. Because I know just for my own self, I've been told I was borderline.
Okay.
Diabetes,
Mm-hmm.
but it wasn't anything with glucose. It was saying something about my thyroid. My doctor told me my thyroids were high, but I just needed to get those down. But they said I was borderline. So does that have anything to do with diabetes, the cause of it?
Well, diabetes is caused of an insufficient hormone, as well as thyroid disease is caused with something wrong with the thyroid hormone. So they're two separate disease processes. So you can have both of them, but they're actually two different diseases, thyroid disease versus diabetes.
Okay, that makes sense. So what are some of the symptoms of diabetes?
Sure. When people have diabetes, they have problems controlling their sugar levels. And that can mean either the sugar can be too high or too low. When the sugar in the body is too high, we call that hyperglycemia. Some of the signs and symptoms of hyperglycemia include irritability, hunger, thirst, a frequent urination, also sleepiness. Sometimes people can have blurred vision, tingling in their hands or feet, nausea or vomiting. So those are some of the common signs and symptoms of when your blood sugar or hyperglycemia is too high.
So why does hyperglycemia occur?
Sure, hyperglycemia can occur when you overeat certain items, when you don't take the medications that you're supposed to take on time, when you don't exercise, hyperglycemia can occur, as well as lack of exercise for less than usual time limits. And also stress can also bring on hyperglycemic episodes.
Okay, now that's something I didn't know, the whole stress causing. So can it be severe?
It depends on how you control your stress. Stress is something that produces more insulin in your body, more glucose in your body, okay? And so when people get stressed, their sugar levels tend to go higher. So it's very important to try and control your stress level as well.
Okay, that's interesting. That's something I did not know. So what can people do to prevent that from happening?
Sure. Hyperglycemia can easily be prevented by checking your blood glucose level frequently. If you exercise only when your glucose level is less than 240, and reduce meal portions when you're eating. Eat less carbohydrates. Take your medications as you're directed. So we also discussed that diabetes not only can increase your blood sugar levels, but it can also have low blood sugar levels. And the medical term for that is called hypoglycemia. Some of the signs and symptoms of hypoglycemia include trembling, weakness, fainting, irritability. Sometimes people can even break out in a cold sweat. Increased heart rate or palpitations, which means your heart rate is racing very, very fast. Hunger can also produce hypoglycemia. Mental confusion, disorientation, and difficulty speaking. And also you can get numbness of your fingers or lips.
How can diabetes affect your body?
Sure. Diabetes has various ways of affecting the body. It affects the body in very different organs. First off, diabetes can affect your kidneys. The kidneys filter toxins out of the blood and get rid of them. So if diabetes affects your kidneys, it prevents your kidneys from filtering out the good stuff and filtering in the things that you need. Diabetes affects your kidneys is one reason. Okay. So diabetes can also affect your eyes. Diabetes can cause blindness in many people. This disease damages the retina in the eye and increases the risk for developing glaucoma and cataracts. Diabetes can also affect the feet. How does it do that? Diabetes affects the nerves in the body, particularly the endpoint nerves, like your hands and your feet. It can cause the sugar levels to go high and coat the nervous system. And when it does that, it affects your ability to feel with your fingers as well as to feel with your toes. That's why we always want diabetics to check their feet, because sometimes what happens is the sugar levels get too high and they often walk on things and don't notice that they've stepped on something, and it can cause a very serious infection. So diabetes can affect several different organs. It can affect your kidneys, your eyes, your nervous system, and your feet.
Okay, so if you see any of those signs or symptoms, then it's best to kind of go to a doctor at that point, even if it's the smallest thing.
Sure.
How do I know if I have diabetes?
Sure. Diabetes can be diagnosed in several different ways. First off, according to the American Diabetic Association, the first thing one wants to do is to check their hemoglobin A1C. The hemoglobin A1C is a blood test that we use, and it basically tests the blood sugar concentration average over 2 to 3 months. That number, if you are a diabetic, would be greater than or equal to 6.5. Another way to diagnose someone with diabetes is to check their fasting plasma glucose. Basically, if you fasted for 8 hours, one can test their blood sugar, and if that blood sugar reading is greater than 126 milligrams per deciliter, that would also qualify one to be a diabetic. A third way to test to see if one has diabetes is to do a test called the oral glucose tolerance test. This test is basically testing your sugar level before you eat a sweet and then 2 hours after that. If that level is greater than 200 milligrams per deciliter, one is also classified as a diabetic. So you also want to know if one has pre-diabetes. So what you would do is take these values, and then if these values are abnormal, one would want to make sure that they get checked on. So someone who has pre-diabetes would have a hemoglobin A1C between 5.7 and 6.4. If their hemoglobin A1C is between that level, they should also get checked out. If their fasting blood glucose level is between 100 and 125, fasting meaning you haven't eaten anything in the past 8 hours, that would also mean that you might have diabetes. The last test, the oral glucose test, if someone has a blood level of 140 to 199, this may qualify someone also with having diabetes.
Okay. Is there any other testing besides these that people can take?
People that have diabetes, they need to go ahead and get checked at the doctor's office, and there are several testing that should be done with routine visits. One is the blood glucose level. Another one is the blood pressure. You want to make sure that your blood pressure is adequate, because if not, you'll have kidney damage, eye damage, and other organs will be affected because the pressure in the body would be too high. Diabetics should also get foot exams. As we discussed earlier, sometimes they have something called a peripheral neuropathy, which is a big medical word that means I can't feel too good on my fingertips or my toes. So it's very important that if you're a diabetic, to when you go to the doctor, to make sure they also check your feet, and that you check your feet too. The other exam that diabetics should also consider is an eye exam to prevent the blindness, because once again, diabetics are at an increased risk of having glaucoma and cataracts. Another exam is a cholesterol test. It's best to have this tested because in diabetics they have a higher risk of having heart attacks and strokes. Another test is called the urine test. As we discussed earlier, diabetes affects the kidney, and the kidney is responsible for doing your filtration of your urine. So one way to test to see if the kidney is working, is to test one's urine. So make sure you also get your urine tested. And the last exam is the dental exam to prevent tooth decay and tooth enamel loss.
Okay. So medically speaking, from that standpoint, how is this treated?
Sure. Diabetes can be treated in several different ways. First off, some people, type 1s, require what they call the medication insulin. Okay? Some people, type 2s, require pills, oral hypoglycemic agents, which are pills. And several different types of manufacturers make several different oral hypoglycemic medications. Sometimes people who have diabetes require both insulin and pills.
Oh. And why is that specifically? Is it just because the glucose is high?
Correct.
Okay. So how can people with diabetes maintain a healthy lifestyle, like within their everyday lives?
Okay. People with diabetes need to also consider healthy lifestyles, as you discussed. Some of those techniques include exercise as well as nutrition. As far as exercise is concerned, diabetics should exercise so they can lower their glucose levels, which is the sugar level in their body. They should also exercise to try and control their weight. And exercising also provides strength and energy. It reduces stress as well. Exercise is a good friend for diabetics. The other healthy lifestyle technique we will discuss, will be nutrition. Diabetics need to also consider good nutritional habits. Let me back up. So exercise doesn't mean you have to go out to the gym every day. You can do just some low-intensity exercising, which would be dancing or gardening or cleaning the house. Yes, cleaning the house is counted. High-intensity exercise or moderate exercise would be like fast-paced walking, bicycling, cutting the grass, those types of things. And let me also preface that if you are diabetic and you're considering exercising, please consult with your physician before attempting to do any type of exercise protocol.
What are some of the nutritional foods that somebody with diabetes can take on, or even, just to prevent? Like, what are some good foods?
Sure. Nutrition-wise, diabetics need to be very informed with the types and varieties of foods that they can eat. The categories are divided into carbohydrates, fruits, vegetables, milk, and proteins. Carbohydrates are needed for diabetics to provide energy. Some examples of carbohydrates are bread, rice, cereal, and pastas. Fruits. Fruits are also good for diabetics as they provide vitamins, fiber, and minerals. And certain fruits that diabetics can eat include oranges, apples, and bananas. Vegetables are beneficial for diabetics because they also provide vitamins, fiber, and minerals. The vegetables included are broccoli, cauliflower, and spinach. And milk is also a good source benefit for diabetics because it provides vitamin D, calcium, protein, and it maintains healthy bones and teeth. If you're going to drink the milk, we recommend 1% milk or yogurt, that type of thing. And lastly, the last food group would be proteins. Proteins are beneficial for diabetics because it helps form muscular tissue. So good sources of protein include beef, chicken, and cheese.
Okay, so in conclusion, do you have anything else that you would like to share with us before we leave today?
In conclusion, I'd just like to say, if you are diagnosed with diabetes, don't be afraid of your disease process. Own it. Go ahead and get support with your family and friends to help you maintain a healthy lifestyle. Keep your regular doctor's appointments and learn as much as you can about your disease process. It will be beneficial to you in the long run.
Be sure to tune into my channel on YouTube, There's a Beautiful Me, for a viewing of my first 2 shows. And also, you can catch this show. You can always contact me for more ideas and topics that you would like to see on the next show at proverbsbeauty31@gmail.com. I'm Crystal. There is a beautiful me, and you are God's beauty inside and out. Before we close out today, I would like to close with some spiritual inspiration. Andrew Swatek is a member of the New Generation Youth Group at the Freedom Center Youth Church here in Missouri City, Texas. He sings regularly with the youth group and also enjoys working as a sound tech in the audio department at the Freedom Center. Andrew is a junior at Elkins High School, also in Missouri City, Texas, and he enjoys playing football and is a member of FCA, Fellowship Christian Athletes. In the future, Andrew hopes to continue playing football in college, so without further ado, I'm pleased to welcome Andrew Swatek.
Oh, that sounded good. Thank you. We're going to turn up real quick right here. Let's go. Here we go. I smile. Hey, today's a new day, but there is no sunshine and nothing but clouds, and it's dark in my heart and it feels like a cold night. Today's a new day. Tell me, where are my blue skies? Where is the love and the joy that you promised me? Tell me it's alright. I'll be honest with you, I almost gave up, but a power that I can't explain, it fell from heaven like a shower now. Hey! And I smile, even though I hurt, see I smile. I know God is working, so I smile. Even though I've been here for a while, I smile. It's so hard to look up when you've been down. I sure would hate to see you give them now. You look so much better when you smile. So smile. Woo! Sounded good. Keep turning it up. Hey! Today's a new day, but there is no sunshine Nothing but clouds and it's dark in my heart and it feels like a cold night. Today's a new day, but tell me, where are my blue skies? Where is the love and the joy that you promised me? Tell me it's alright. The truth is, I almost gave up, but a power that I can't explain fell from heaven like a shower now. Woo! And I smile, even though I hurt, see I smile. I know God is working, so I smile. Even though I've been here for a while, I smile, hallelujah, smile. It's so hard to look up when you've been down. I sure would hate to see you give up now. You look so much better when you smile. So smile, break it down. Hey, just smile for me. Can you just smile for me? Hey, smile, smile, smile for me. Can you just smile for me? Oh, and the people say, oh, 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 you look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you smile. I almost gave up, but a power that I can't explain fell from heaven like a shower now. Hey, I said right now. Woo! And I smile, even though I hurt, see I smile. I know God is working, so I smile. For a while, I smile, hallelujah, smile. It's so hard to look up when you've been down. I sure would hate to see you give up now. You look so much better when you smile. So smile, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you smile. Hey, da, da, da.